Sympathomimetic drugs, also known as a adrenergic agonist medication. People say adrenergic drugs. There are different words that people use for this ANS drugs, and I would highly recommend that you watch the autonomic nervous system video before you watch this one, because it will help you to understand all the different receptors in the sympathetic nervous system and parasympathetic nervous system has, and what are the physiological responses when you activate, or if there is a medication that goes and binds to the receptor and activates them. In this video, we're gonna learn about the sympathomimetic drug space, and I have divided these drugs in a 3 section: the mixed agonist, and in this section we'll look at the medication that works on more than one sympathetic nervous system receptors. Alpha agonist will in that one take a look the medication that particularly works on the alpha 1 and then alpha 2, and we'll take a look into this lastly the beta agonist, and especially we'll go over beta 2 agonist medication that goes and binds to this beta 2 receptors in our body. So let's take a look in the mixed agonist. The first drugs we're gonna take a look into is epinephrine, and this is a really important drug, not only as a nurse that needs to know for NCLEX, but this is really important drug if you're gonna work in an intensive care unit after you become a nurse, because you'll be using these drugs a lot of time as a drips, and also some mostly in cold blues as well. Not mostly, but all the time, I would say. So these drugs work on 3 different receptors in our body: the alpha 1, beta 1, and beta 2. And these are the sympathetic nervous system receptors. When this drug goes and binds to alpha 1 receptors in our body, what it does, it causes the vasoconstriction, and it increases the drainage of aqueous humor and decreases the intraocular pressure, because that aqueous humor gets drainage out of the eye, that will decrease the intraocular pressure. Now when this drug goes and binds to the beta 1, it has a positive inotropic and chronotropic, so it will increase the force of contraction, heart rate, force of contraction of heart rate, and eventually this will increase the cardiac output. And finally, this medication also works as on the beta 2 receptors in our body, which will relax the bronchial smooth muscles and vascular smooth muscles. So what it will do, it will cause this bronchial smooth muscle relaxation, so the trachea will enlarge, and there will be air movement will be really easy throughout the lung. And when it relaxes the vascular smooth muscles, it's going to cause the vasodilation. Now there's a thing to remember: the beta 2 receptor are, like, if you have watched the autonomic nervous system video, the beta 2 receptors are mainly located into the bronchial smooth muscles. There are only few from are present in vascular smooth muscles. So even though it causes the vasodilation is not as significant. So the blood pressure does not decrease significantly. And this beta 2 vasodilation will be overshadowed by alpha 1, because when the alpha 1 mostly present in the vascular smooth muscle, and it will cause the vasoconstriction, so the blood pressure will go up, because this effect's gonna be more compared to this beta 2 vasodilation, because there are not too many beta 2 receptor present on the vessels. So if you now we understood this mechanism of action and what receptor it binds to, and what is the physiological response of this epinephrine drug. Let's take a look into the indication, like in which disease process we can use this drug and what are the side effects. So obviously, definitely in shock we can use this medication, And the reason we use in the shock is usually like either if it is a hypovolemic shock, if it is a septic shock, or a cardiogenic shock, or a neurogenic shock. Mostly happens is the decrease in blood pressure, and we will use this drug as an IV drip to increases the blood pressure, and also to increase the force of the contraction of heart, and also the rate, so the cardiac output will increase as well, and so all the vitals organ in our body will get perfused. Since this medication also relaxes the bronchial smooth muscles, we can use this medication as for the bronchospasm. Now, what if we give this medication for the bronchospasm IV? Well, it's gonna definitely have an effect on different organs on top of this bronchial smooth muscles. So that is the reason whenever there is a bronchospasm, we give the racemic mixture of epinephrine. Now, when we give the racemic mixture, what I mean by that is this epinephrine will be diluted into the normal saline, and the concentration of the epinephrine will be so low, and we'll give this one as a breathing treatment. So we'll give it as aerosols or inhalers, kind of like that stuff. So it'll have a local effect in the bronchial muscles only, not throughout the body. So that's kind of interesting thing too. And also we use this medication for glaucoma as well, since it decreases intraocular pressure. Since this one causes the vasoconstriction, so what if we give this medication locally to the certain area of the body? Let's say if we need to give a local anesthetic medication, they usually give this epinephrine with the local anesthetic, and the reason they do it, this one will cause the local vasoconstriction. Now, it will cause the vasoconstriction, so the medication, the anesthetic medication, the local anesthetic that we give will stay in the area for a longer time compare when we give it on without this epinephrine. So they usually use this medication with the anesthetic, so the anesthetic medication effect will stay longer than usual. And also this medication, also we use this for hypotension, since it causes the potent vasoconstriction. Let's take a look into the side effects as well. Now, whenever we think about the side effects of any kind of ANS drugs, is usually the physiological effect this medication has on our body that we do not want. So for example, for this epinephrine, we do not want any kind of GI effect. Let's say the blood pressure is going down and we want to give this medication to increase the blood pressure. However, if you're looking into the sympathetic nervous system, there are many other effects sympathetic nervous system has on our different body parts, like a GI. Now we don't want GI effect, but it will have GI effect. So it can cause nausea, vomiting, and kind of like that stuff as a side effects. Like sometimes it can increase the heart rate really high, so the patient may feel the heart palpitation. It can cause the cardiac arrhythmia as well, sweating, and also the headache. Now, since this medication is used for hypotension, but if we give it too much, it can cause the hypertension. And when you will start working in the intensive care unit after you're done with the nursing, you may see there are many patients. Like one patient will react differently than other patients, especially for this IV vasopressors. So like this epinephrine, norepinephrine, dopamine, dobutapine, all kinds of medication that we use in the critical care, all the patient will react differently. So you have to be really careful when you're titrating this drug in order to achieve the goal blood pressure. Okay. The next medication we're going to take a look into the norepinephrine. Now, if you remember, the epinephrine has an effect in alpha 1, beta 1, and beta 2. However, this drug does not have an effect on beta 2. This drugs work on alpha 1 and beta 1. When it works on the alpha 1, it causes a vasoconstriction and decreases the intraocular pressure. And beta 1, positive inotropic and chronotropic, gonna increase the force of contraction and the rate of contraction in heart, and eventually it's going to increases the cardiac output. So what are the indication? We can use this for the shock, as we talked in the previous slide as well, that in the shock it causes the hypotension, like a vasodilation throughout the body in most of the shock. Then we can use this medication for the to increase the blood pressure, so all the vital organs can get perfused, hypotension and cardiac arrest. So now, and also the side effects gonna be the same as we talked in the previous slides, like all this arrhythmia, hypertension, heart palpitation, headache, nausea, vomiting, and sweating. Now, the next drug is dopamine. This is really interesting drug and important drug to know. Falls under the mixed agonist category. Now, this medication is dose dependent. So dopamine, when you give this medication 2 to 5 microgram per kg per minute, it works only on dopamine receptors. And what does this dopamine receptor does? It dilates the renal and coronary and splanchnic vessels, and when it does, the kidney will get more blood flow, since the vasodilation will decrease the blood the pressure in the kidneys. So that's why we use this medication sometime in the cardiogenic shock, so the kidney can get the enough blood perfusion. Now, in the beta 1, when we give this medication from 5 to 10 microgram per kg per minute concentration, it will work on beta 1. And when it works on the beta 1, we'll have a positive inotropic and chronotropic effect, which will increase the heart rate and the cardiac output. I mean, the force of contraction as well, and that will increase the cardiac output. However, if we give dose greater than 10 microgram per kg per minute, it's gonna cause the potent vasoconstriction. It's gonna increases the blood pressure. So this drug is kind of totally depending on the how much dose you give to the patient, and it will have that kind of physiological effect accordingly. So that's why there are like a different uses for this medication. We can use this medication to increase the blood pressure if we give dose higher than 10 microgram per kg per minute. We can increase the blood flow to the kidney if we give dose between 2 to 5 microgram per kg per minute. And we can use this medication for the cardiogenic shock if we use this medication in this concentration, because it will increase the cardiac output and the also will increase the heart rate and also the force of contraction. So this drug's kind of a little bit interesting and also tricky at the same time. The next drug is dobutamine. Now, dobutamine works on beta 1 and beta 2. This medication does not have any effect on dopamine receptors, because this medication is kind of like people always get confused with dopamine, because they kind of like look like the same, they kind of like sounds like the same, but there's a difference. The dobutamine does not work on dopamine receptors. However, this is kind of good drug than dopamine. If you're just giving it for the cause like a congestive heart failure or cardiogenic shock, because this one particularly works on beta 1, and that will have a positive inotropic and chronotropic effect, and will increase the heart rate and cardiac output as well. Now, when it works on the beta 2, as I told you, like there are not many beta 2 receptors on vessels, blood vessels. However, there are some, so it can cause the vasodilation. Now, when it increases the heart rate and force of contraction plus decreases the systemic vascular resistance, which is blood pressure, by doing this vasodilation, heart workload will be decreased, because heart won't have to pump really hard in order to get the blood out of the heart, because there's not much systemic vascular resistance. So this medication is really good for congestive heart failure and also for the cardiogenic shock. And usually this medication is also used as IV medication, IV drips in critical care areas. And this is not a dose dependent drugs as well. This is not a dose dependent drugs like dopamine. Okay. Now the next category we're going to take a look into the alpha-1 agonist. Now there's main 4 drugs fall into this category: is phenylephrine, methoxamine, metarimonol, and midodrine. And when this medication goes and binds to alpha-1 receptors in our vessels, it causes the potent vasoconstriction. That's why we can use this medication in a shock where we have to increase the blood pressure to maintain blood pressure during the anesthesia, because often if a patient's under anesthesia effect, they get the hypotension. So we can use this one, and also for the orthostatic hypotension. And I have seen midodrine used for orthostatic hypotension often. Now, if we use these medications as a nasal spray, it can decrease the nasal congestion, because there are small blood vessels in our nose, in nasal area. What happens during the nasal congestion, because there's so much secretion, either due to the allergy or any kind of some kind of reason, that they secrete the more secretions in our nose, and that causes the nasal congestion. They are dilated during the nasal congestion. So when we give this medication as a nasal spray, it will cause the potent vasoconstriction in our nasal area. And what it will do, it will decrease the all secretion in our nose. So that's why we can use this medication for nasal congestion as well. So if you're using this medication as a nasal spray, it may not have a systemic effect, but in some cases, if people use it more than recommended, it can have a really bad systemic effect. Like it can cause the high blood pressure, heart rate's gonna go up, and so forth. Now the side effects is like as we talk, like the side effects of these medications are the non-wanted physiological effect of the medication that we're gonna have. So in sympathetic nervous system get activated, you can have anxiety, restless, like all kind of stuff. You can have EKG change, blurred vision, fatigue, can go to depression. It can cause the cardiac arrhythmia, and since the decrease in urinary output and the GI system's gonna be inhibited, so it can cause the anorexia as well. Okay, alpha-2 agonists. This is also really good, interesting category to learn. Now, since if you have watched the autonomic nervous system video, whenever we excite this alpha-2 receptor, which are located centrally, remember this receptor are located centrally. When we excite this receptors, or if we give a medication that goes and binds to these receptors, it's gonna decrease sympathetic nervous system. Okay, so it's gonna do the actually opposite by exciting this receptor, exciting this sympathetic nervous receptor, which are located centrally in brain. It's gonna decreases the sympathetic nervous system effect peripherally. So this medication will cause the vasodilation, since it's gonna decreases the sympathetic nervous system effect peripherally. Now, the medication that falls into this category is clonidine, methyl-dopa, and this is a really interesting drug too, dexmedetomidine. And I'll get back to that one really quick too once we are done with this. So it causes the vasodilation. So this medication can be used for high blood pressure, and this medication, only the one of them is used for the sedation, and this is dexmedetomidine. Well, it took me a long time to pronounce that one right. It's also called the Presidex. That's the trade name. Let me write it really. Presidex, and usually used as an IV drips in a critical care area for the sedation, because this medication goes and binds to the alpha-2 receptor located in the brain and causes the sedation. And if a patient on this medication, you have to be really careful, because I have seen many patients when we put this medication on for sedation, their blood pressure drops significantly. Like if they're running, like, let's say 160 over 80, they will drop to like 90 over 60 like in 15-20 minutes if they're so labile to this medication. So sometimes if you put a patient on this medication, you may need another vasopressor like a phenylephrine, which is alpha-1 agonist, as we talked previously, like epinephrine or norepinephrine. Vasopressor in order to make sure we maintain enough blood pressure. So that's the medication I was talking. That's kind of really interesting to know that we use it in critical care more often for sedation. So the side effects: this medication can cause drowsiness, dizziness, dry mouth. And if we stop this medication, like if a patient on this medication to decrease their blood pressure, but is for some reason, if they stop this medication suddenly, they can have a rebound hypertension and the blood pressure can go really up. So this is one of the side effects. And precaution: you don't really want to give this medication for a patient who has a recent MI, cerebrovascular accident, or a stroke, diabetes mellitus, because like sympathetic nervous system works on liver. It can increase the glucose production and can cause the increase in blood glucose level. Okay, so you want to be really either careful or avoid this medication if a patient has a diabetes mellitus, and renal and liver disease. If a patient has, you want to avoid this medication as well. All right, the next one and the last one, beta-2 agonist. The medication that falls under this categories are albuterol, formoterol, isoproterenol, metoprotrenol, ritodine, salmeterol, and terbutaline. What it does, as we remember from autonomic nervous system video, that these receptors are present in bronchial smooth muscles and uterine smooth muscles. So when we give this medication and activates this beta-2 receptors present here, bronchial and uterine smooth muscles, it's going to dilate both of these smooth muscles. So, and it will have the physiological effect. So if they do these things, we can use this medication for asthma. We can use this to treat shock and ventricular arrhythmia, and this is for only isoproterenol because it has beta-1 effect as well. The other medication in this category has only beta-2, so like this one is beta-2, only beta-2. This is beta-2 as well. This is beta-2, beta-2. These are all beta-2 except this isoproterenol. Now there's this ritodrine, or sorry, I misspelled that one. It's not ritodrine, it's ritodine. That medication's also used to slow the uterine contraction if in a pregnant woman. So that's the only medications being used for currently. And these other medications are used for, and this medication is kind of interesting to know. If you know, albuterol is used for like asthma, because these are like a really short acting, like it works in minutes. So you want to give this medication for like a status, not status, in asthma, when their respiratory system is compromised and they can't really breathe. This medication works really fast compared to the other medication in these categories. The side effects, as usual, they're like all other physiological effect that we do not want, is restless, anxiety, tremors, headache, tachycardia. It can cause the really bad heart pain, angina. And there's also another thing too, like this medication only works on beta 2, but it can have another physiological effect. So usually this medication, if you're giving for asthma, we can give it as an inhaler or nebulizer like that, but still it's gonna have some absorption systemic absorption. So that's why it can cause these side effects. It can cause MI, heart palpitation, GI system unwanted effect like nausea, vomiting, anorexia. It can cause really bad pupil dilation and muscle cramps. Okay, so that was it about in sympathomimetic drugs. I hope you understand them really well. If you have any questions, let us know or email us. Thanks for watching.